Firearm violence is a public health crisis. Our failure to address it is a moral crisis. To protect the health and well-being of Americans, especially our children, we must now act.
And the Surgeon General did just that today. The U.S. Surgeon General, for the first time ever, declared gun violence a public health crisis.
So what does that mean? Well, Surgeon Generals give warnings like this from time to time. In the past, there have been Surgeon General warnings about things like tobacco and alcohol. But today, Dr. Vivek Murthy is calling attention to the significant physical and mental toll gun violence is taking on Americans and their communities. So today's advisory comes with lots of data that proves all of that, including the fact that since 2020, firearms have been the #1 cause of death for kids under the age of 19, more than car accidents, drug overdoses, and cancer. It also found firearm-related suicides increased by 20% in the 10-year period between 2012 and 2022. The biggest increase, sadly, came from kids and young adults between the ages of 10 and 24. Data shows firearm-related death among young people is a uniquely American problem. The United States outpaces all other advanced nations when it comes to youth firearm death by a lot. And when you zoom out to all age groups, according to the Surgeon General, in 2022, suicide by firearm accounted for more than half of the deaths. But a close second was firearm-related homicide. And of those homicides, those in the Black community saw the highest rates. And when it came to suicides, male military veterans were disproportionately affected. And when it comes to mass shootings, the Surgeon General points out between 2020 and 2023, the United States saw 600 mass shootings. That's significantly more than the previous 3 years when there were 400 incidents reported. Now, while 600 sounds like a large number, it is, but the Surgeon General says mass shootings make up only about 1% of all firearm-related death in the United States. But here's the thing. Yes, that 1% is obviously small, but the Surgeon General says mass shootings have an outsized traumatic impact on the community where they happen and cause an outsized negative perception of public safety. The Surgeon General's 40-page report also found just the presence of a firearm in the home is associated with a higher risk of being a victim of homicide and suicide, and an unlocked firearm in the home is associated with a higher risk of suicide and unintentional firearm injury among kids and adolescents. So now what? Well, Dr. Murthy wants the firearm conversation to shift among Americans and lawmakers. He wants to start taking a public health approach to firearm violence. He's asking for increased funding for more gun violence research to inform more prevention strategies. He wants to see things like community violence interventions and improved access to mental health care for those exposed to or at risk of firearm violence. So if you want to read the Surgeon General's report and learn more about this public health advisory, I will email it out to you tonight in my News Girl News Roundup email, so make sure you sign yourself up.